day, a very important announcement. My name's Bill Underwood. I have the privilege of serving as president of Mercer University and the special privilege of welcoming so many special guests to our university today. There's nothing more important than our children. We'd do anything for them. Certainly, we want them to have access to the best health care possible. And that's true regardless of where you live. And I think this initiative today is all about ensuring that our children have access to quality health care regardless of their zip code. That's what this is about. And I think this initiative that you're going to hear more about from Donna Highland and Gene Sumner and Jennifer Tarbutton, I think this initiative is going to be a powerful step towards achieving that goal for children in the state of Georgia. So I'd like to begin by introducing Donna Highland, who serves as the CEO of Children's Healthcare of Atlanta. She's built it, led it into becoming one of the great children's hospitals in North America. And we're so pleased that you could be here with us, Donna, and that we could be partnering with you on such an important initiative. So please, Donna.
Well, thank you so much. It's our privilege to be here. And we just keep remarking on what incredible people that we've been able to meet through this work. And we're just so grateful to you. You know, Children's Healthcare of Atlanta, some people may not know this, but it's been around for over 100 years taking care of the kids of Georgia. And we see that as our responsibility to do everything we can to help as many children as we possibly can. It still pretty much amazes me that every year we care for children from all 159 counties in Georgia. We all know we have a lot of counties in Georgia, but we have an expansive system that tries to get kids to the right place for care. And this is going to be an incredible initiative to help get some of that care even closer to where families live, because we know it's a burden to have to drive for your health care. Last year, we saw 32,400 kids who reside in rural Georgia, and that was just under 80,000 visits to children. So we are so proud to be able to serve as many kids as we possibly can, because as you said, I mean, getting kids off to the right start in life is going to help them throughout their entire lives. And one of our doctors always says every child deserves a lifetime. That's in our Aflac Cancer Center. And I just love that because I think it's so true and so important. So last year, our Board of Trustees very thankfully has set aside $200 million to support efforts to help do what is needed in rural Georgia. And I don't remember exactly how I met Dr. Sumner, but what a lucky day it was. And then she introduced us to Glenda and all the great folks at the Georgia Health Rural Innovation Center, because you all know the pulse. You are in the communities and you are the ones that know how to really have the most impact. And so it is just an extraordinary partnership for us to be able to be part of and to be working with each of you. You know, I know you're going to hear more about some of the components of it. I saw the young medical students in your coats. That makes me so proud, although you look like you're 15. But a really important part of this are going to be scholarships. And Mercer has been so successful with the Nathan Dill Scholarship. So part of this will be funding in 23, starting with 10 pediatrician scholarships that will fund students who want to be pediatricians who make a commitment to go back and practice in rural Georgia. And I get so excited about thinking about 10, 10, 10, 10. I mean, over a period of time, we could really help solve the issue that there are, I think, over 60 counties in Georgia that don't have a pediatrician. And Dr. Sumner's talked to me about, I mean, we live taking care of kids, how important it is for a child to have a pediatrician who's watching their growth and development and making sure that they're getting what they need. So we're so excited about the Children's Healthcare of Atlanta Rural Scholarship Program. and the beautiful button that the pen that's been designed that will honor these students and certainly honor us. We're also very excited about Children's actually has the most pediatric emergency visits of any other children's hospital in the United States. And so we're going to offer and use that expertise to work with some of the rural hospitals who get kids. Maybe not a ton of kids, but we want to make sure that there's the right equipment, the right training, and that we are using whatever expertise we have to help support the children that end up in, for whatever reason, sadly, that they have to go to an emergency room. So we're very excited about that, to have kid-ready emergency departments all across our state. And then we know there are some things that you just have to come to Atlanta for because of the expertise that's there. So we're making a donation, significant support to the Atlanta Ronald McDonald House to pay for food and housing so that families that have to come to Atlanta for their treatment will not have to worry about that and have a good home away from home. And they just do amazing work for anybody that's ever been to that. So, I mean, we live for kids. We love Georgia's children, and we could not be prouder to be working with Mercer, with Dr. Sumner, with Dr. Tarbutton, with Glenda, with the phenomenal people that we've been able to meet. We just can't wait to see what kind of impact we're going to be able to have together. So thank you very much for the opportunity, and thank you to this community for being so welcoming to us Atlantans that have landed here. But we're just so proud and so excited about this. And somebody yesterday said, we can't wait to see 10 years from now the difference that we made. I'm so excited about that and just can't wait to see what we're going to be able to do together. Dr. Sumner.
I want to brag on Dr. Sumner for a minute. Donna said it was a good day when she met Gene Sumner. It was a great day for me when I met Gene Sumner. I had my colleague Hugh Sosby was in my office, and I was telling him that it was going to be really difficult to find the right dean for our School of Medicine. I didn't know where we would go to find somebody who was truly committed to our work. And he said, well, why don't you go talk to Gene Sumner? And the minute her name left Hugh's lips, I thought, of course. She's a great dean, a great leader. She is the living embodiment of our mission. So, Gene.
Mercer's a great place to work, and what I hope children will learn, if you don't know, is they focus on educational excellence and service. And if you walk around the campus, you'll see these flags that say, at Mercer, everyone majors in changing the world. They are serious about it. That is not just a slogan. At the medical school, we major in changing one Georgia rural county at a time. So we modify it a little bit. But the person who needs to be thanked for this, and the institution is making Children's Healthcare of Atlanta. And I think we need to give Donna and her team that are incredible people another round of applause. I said this yesterday, but I mean it. Children's is a treasure. You may not know that, but I want to encourage every one of you to figure out who Children is and what they do. They do it better than anybody, and they do it well. But they are the experts in the specialty care of children, and certainly they do general pediatrics. This initiative is made possible through their desire to help all of Georgia more than they're helping all of Georgia. They're already helping, but this will help us all. It will allow parents to take their child to the local emergency room and feel confidence in that emergency room. We have great rural hospitals, and I've worked in one my whole life. You get good care there. You know your doctor. But taking care of children's needs is a challenge sometimes when you don't see many. We want to build confidence in the local community of the ability of their rural hospitals and build the skill of those physicians in the emergency room. We know that we have great pediatricians in rural Georgia, But I can tell you, because I know it, is when you're in a small town, you're the only doctor in the county, which I've been, it gets a little lonely. And sometimes you just want a second opinion. Sometimes you just want to show another colleague a case you have. We're building that network with this initiative. This is an effort, and I did say that yesterday, nicely, thank you for remembering. In 10 years, I want you to look back and realize that this initiative is a foundational change in Georgia. We're going to bring everybody together for the good of children. We don't give up, we keep at it, but it wouldn't be possible without this institution and the affiliation that we've been able to grow. So thank thank the team. They have little green pins on them. I learned a lot about will and hope. I hope you know we will do this. Thank you, Don. Thank you, children. Thank all of you for being here. And we look forward to having lunch together and meeting each of you. I love introducing Jennifer because Jennifer and I worked together for a long time. And she's a pediatrician. I'm filling in sometimes. When my grandchildren were born, and I told Donna that I fell in love with Children's Hospital, and one of them had to go to a Children's Hospital in Texas. And they called us and said, she's really sick. And they told me the diagnosis, and they talked to me like the doctor, and I thought, I'm not the doctor, I'm the grandmother. So I called Jennifer, and I said, Jennifer, this is what they said. And she was lit into telling me all the doctor stuff, and I said, stop, tell me I'm the grandmother. And she said, she's gonna be fine. She's gonna be fine. And I never forgot that. I just knew she was gonna be fine because Jennifer said it. But I told you, at Christmas Eve one year, Jennifer and I were both in the ER in Sandersville, Georgia. She was taking care of a child. That's the kind of pediatrician she is. She trained a chore through an Emory residency. She knows how great. Children's Healthcare of Atlanta. Children's Healthcare of Atlanta. She trained at Children's Healthcare of Atlanta, and she came to Sandersville to help Washington County children be healthy. Healthy children make healthy adults. And the chronic disease in rural Georgia is more than we can tolerate as a state. We've got to get our children to healthy. Jennifer's a great pediatrician. She's a real doctor. She works every day. And I'm proud to call her a friend. And also, she's the chairman of our board of governors and a trustee here at Mercer. So thank you, Jennifer.
Thank you, Dr. Sumner. I want to say, first of all, that these are my two most favorite educational organizations in the United States. And it happens to be that both of these are places I have trained. So Mercer built the foundation of my medical school education, and then Children's Healthcare of Atlanta. And Dr. Fortenberry helped train me to be the pediatrician that I am now. And without these two starts to my education and my career, I couldn't practice medicine in a rural area. And Dr. Sumner is correct. It sometimes does get lonely, but it's very wonderful too. So I certainly love all of my patients, love taking care of them. And I have loved Dr. Fortenberry, and the CHOA network through COVID has been wonderful with the educational seminars that they have led every Wednesday. So now moving forward with this collaboration, not only me and Dr. Hilton, but all the pediatricians in the state will be able to have access to the same education, and the children of the state will benefit from that as well. So thank you so much.
Okay, that concludes the announcement. Donna and Jean and Jennifer are available for the media folks who are here. If you all would like to do an interview, the three of them will be up here and available to you all. And with that, we'll adjourn.